This isn't getting nearly enough attention, I think, as we're talking about what the country should do. People with coronavirus are crossing the USMexico border for medical care. This is from CNN. Chris Van Gorder says he's seeing a telling trend in the hospitals he runs. Coronavirus patients are showing up in emergency rooms after calling 911 from the U.S.-Mexico border. They'll literally come to the border and call an ambulance. This is the president and CEO of Scripps Health in Southern California. The rise in ambulance traffic from the border, which several officials described to CNN, is a symptom of the pandemic spread in the region. There's just not a wall for viruses at the border, according to someone at the, Center for, whatever. The wall is an illusion because the two sides are really woven together. No, actually, what this, isn't it so funny? CNN immediately says, look, we have coronavirus cases coming over our border. This tells us that we shouldn't have a border. That's the exact wrong thing that this tells us, CNN. But notice the trick. They report on this and very quickly turn it into a narrative that's more to their liking. The real narrative should be, we're not taking COVID cases into this country from outside of this country. That's been true of cruise ships. That's been true of airlines. It should also be true of our southern border. You know, we're always being told about the possibility of hospitals being overwhelmed, hospital capacity. This has got to be a we take care of the people in this country first situation. All right. We're always hearing about what a great healthcare system they have in other countries. And, socialism is fantastic in these countries. Yet somehow everyone kind of knows if your life is really on the line, you want to be in America. You want to be in America. Not a surprise to any of us who try to live in the real world. But, yeah, you have people coming across the border who have COVID and are calling for ambulances. Remember, nosocomial transmission of this. Nosocomial transmission is when people in the hospital give this to other people. That's still one of the main ways that this is passed among people. Intrafamilial and nosocomial are very much at the front end of how people get infected with COVID-19. So putting more and more people in the hospitals, particularly if they have really bad cases, which I'm assuming they do if they come to the border, this is now straining the public health system that we're already told is strained, that is supposed to be for Americans. It's not supposed to be foreigners show up here because they want American healthcare treatment. Now, a lot of people say, oh, that's not nice. Really? We're being told that we're going to have hospitals overwhelmed any second. Do any of the libs that would say, oh, we should just take anyone who shows up here from outside of America and take them in and give them treatment? Would they feel that way if it was their mom or dad who was waiting in the ER to see if there's a hospital, an ICU bed for them while they have COVID-19? Very easy to virtue signal on this one, isn't it? But here you have a lot of people that are showing up. Now, some of them are U.S. citizens who are coming across the border. But it also goes to show that border controls. So the U.S. citizens who are across the border in Mexico are coming back and saying they have COVID, but it also goes to show you why border controls are so very, very important. So we'll have to see as these numbers continue to play out. So that's where the situation is right now, my friends. I've some of you have been pointing this out and saying this. I'm very curious to see what the number of illegal crossings are. I have not seen that quite yet. So we'll see what ends up happening here. But for now, having a secure border is clearly important, especially given that there are cases that are now coming across the border into the United States and people are bringing in the virus. So, I don't know if we're supposed to believe that all illegal immigration has stopped in the country right now, but I'll tell you this. If I were living in northern Mexico and I had COVID-19 and I thought I could get across the U.S. border, and remember, ERs have to treat people. They cannot be turned away. I might make a run for it, too. I might decide that I was going to try to get into a U.S. hospital as well. Is there any data on this? Do we have any numbers? Nope. But I will continue to follow this. Hey, Team Buck, thank you so much for watching The First on YouTube. If you like this video, please click that little thumbs up button so then it will log as liked. And also, if you want to see more great content from The First, please click subscribe.